Hello everyone, thank you for listening to the Code Life podcast. This podcast provides a forum for discussions on healthcare issues and challenges with specialists from diverse backgrounds. I'm Sylvie Riendeau, your host today. In the medical field, surgery is never taken lightly. It often represents the last treatment option for diseases, such as cancers, or serious injuries. The fact is that surgery has a high impact on the body and the psychological balance of patients. Throughout the years, new surgical techniques were developed in order to reduce the impact of surgery on patients. A good example of that would be the minimally invasive surgeries that are now performed on patients, requiring only small incisions thanks to the very precise tools now available. But apart from what is done inside the operation room, medical teams are now more than ever aware of what can and should be done before and after surgery to limit risks of complications and reduce hospitalizations and recovery time. Welcome to the Code Life podcast, where we meet today with Dr. Franco Carli, professor at the Department of Anesthesia of the McGill University Faculty of Medicine and director of the Perioperative Program, also known as POP program. Hello, Dr. Carli.
Good morning. Bonjour.
Also with Dr. Carli today is Dr. Enrico Minella, PhD at the McGill Faculty of Medicine. Hello, Dr. Minella.
Hello, bonjour.
All right, so let's dive into the subject here. Can you explain us what is the POP program exactly?
So first of all, the name POP reminds you something coming out of the champagne bottle. So POP, energy. So the idea of POP is to help patients to recuperate faster after surgery. But in order to obtain that, you need to prepare them. So I like always to take the example of the marathon, preparing for the marathon. Marathon is a major stress from the point of view physical, emotional, psychologically. They are very under stress, these marathon runner, and also nutritionally. So why not adapting the same concept from athletes to patients and patients at risk going for surgery and preparing them? So it makes sense that beside optimizing them from the point of view of pharmacologically and medically, diabetes, hypertension, and so on, we actually optimize from the fitness point of view. And I say fitness point of view, mentally, of course, nutritionally, physically, emotionally.
So you were also mentioning the psychological aspect of this training before the surgery. What kind of services do you offer for that?
We don't have a psychologist per se, because these are not behavioral changes. You don't change your behavior in 4 weeks. Mm-hmm. But we have a support by clinical psychologists. So our personnel is trained to suggest to patients something like meditation, yoga. Some patients do yoga. Visualization, imagery. There are different techniques. We're giving a CD, where they can actually listen to music, depends where they like it. Mm-hmm. Deep breathing exercise is very important for relaxation as well. And then there are patients who really are, we have a questionnaire which indicates to us the level, either depression, it's a severe depression, or severe anxiety, then we can refer to a specialist, either psychologist, psychiatrist. Otherwise, I think this is a general concept of relaxation, but not only in that relaxation, but also as a stimulation, right, to continue the program, right? Because continue the program is always difficult. Compliance is always a problem in all these studies, right? Mm-hmm. How long they can go for. So a preliminary study we just finished doing is really preliminary, a small number of patients. We know that 1 year after, about 60-70% of patients continue to exercise. So this is quite interesting. We have not really paid attention much to that, but I think that's something that we really have to. So when you talk about psychological aspect or emotional aspect, I like to call it more emotional relaxation strategies, is very much teaching the patient to be in control, self-efficacy. That's crucial because then they know they can actually do the exercise. They see themselves, oh, this is not complete. Remember, our population is in the 60s, 70s years old. So the concept in the 30, 40 years ago was not gym, go to the gym, you work.
Yeah.
That's it. That's your life was working, and physical work, the majority. So therefore, they come to a new world where you actually see this machine, they can help. So they become in control, and they can see maybe they lose weight, they feel better, they breathe better. And they tell you, really, oh, my pants are going down, my belt is actually, right? But this is an example to say, but they breathe better, they feel better, they're stronger. And that's what is important for them. They give a sense of ownership.
Yeah, exactly. And even on the psychological aspect, when you feel better physically, helps your psychic as well, for sure.
Body and mind.
What are the patients? Is it any patient who can benefit from this program? How do you, is there a selection? How does it work?
Sure. Well, remember that potentially any patient can benefit, right?
Of course.
But I think probably our resources, because of limited resources, we should really consider 2 points. One is awareness, making patients aware what they're going through. The surgery is a stressful event, and not only for the patient, but for the family and for the society too, because there are costs related to them. So one is a teaching moment. So teaching moment like stopping smoking, control your alcohol intake, lifestyle changes. So one is aspect of that. And then I would say intervening on the one who are really, I would say, more at risk. So you take elderly, frail patients with the major comorbidities, patients who are obese, or they go from extensive surgery. And that's where you need to probably put more money into it, in the sense that you have a much more intensive type of training, preparation, and so on.
All right. And how did this start at the Montreal General Hospital?
Yeah, well, it started about 6-7 years ago. And we started with looking at the effect of exercise on patients. And then we came being aware that you need a much more holistic approach, where you have the nutritional aspect, extremely important component. And then, of course, you have the psychological aspect, the emotional, and refining also the type of exercise. So really we're learning from physiology, exercise physiology. We are learning a lot from nutritional also. So the program is a structured program and personalized. That means one doesn't fit all. So it is important that patients are assessed first properly. And then it is they are oriented towards a program which fits them and also follow them in the progressions.
We have Dr. Minella, who's a PhD student at the McGill Faculty of Medicine. And so, Dr. Minella, you chose that field of study for your PhD. How did that came up?
Came up because there is an urgent need for all the patients suffering from cancer to have exercise and nutrition to be integrated in their cancer care. There is this really urgent need. And so I'm an anesthesiologist, so I take care about all the perioperative phase, and surgery is a key point in all the cancer care. So I came here also because this is one, I think, the only center in North America, and now there are just few in Europe, but this is at McGill we really have the first center that has been trying for 5, 6, 7 years now to integrate this basic concept of good nutrition and exercise done before surgery in order to prevent all the detrimental effect of the intervention. That it's really useful, of course. It's a key point in the cancer care, but we really do need to have all these elements integrated for the patient.
Absolutely. And it strikes me to know that you're both anesthesiologists. So it comes from, you kind of well, it comes from, like you were saying, preparation of the patient before surgery, and that's where, you know, you're the specialist who will be with the patient before. But, you know, in our minds, for anesthesiologists, we think of drugs or, you know, something that's going to stop the pain or make us unaware that we're having a surgery. So it's very interesting that how this came up in this field, actually, from anesthesia.
Yeah, it's interesting. I think it's part of our field because we really do know what's happened during the surgery, and we do know all the stress related with the operation. So in our personal opinion, it really makes sense that the anesthesiologists, for the research and for the clinical aspect, they start to go outside the operation room and start thinking about preventing what could be happen during the intervention. Okay, with adding no drugs, that's the point. Rehabilitation and POP is no drugs, no more other drugs, just nutrition, exercise, and the psychological aspect for the patient.
Well, that's great. And this question goes to you both. I know it makes perfect sense that you want to be, you know, like before running a marathon or doing any kind of competition, you're going to be training and getting ready for it and being in shape for it. It's completely logical. So we can wonder, you know, what is the place that it's given in the medicine study to such a program and thinking more holistic approach of medicine and health? Do you find it something quite new, or was it there at some point in medicine, gone and then came back? What are your thoughts on this?
Well, there are some aspects. If you take, for instance, cancer care, right? There is some understanding that holistic approach is not only the pharmacological approach. So especially patients who are in final part of their life and so on. So they receive emotional aspect, nutritional aspect, cancer cachexia, for instance. So there are precedents already. But and I think that we are not replicating anything, but we are taking from aspect of care, which is used, for instance, if you look at rehabilitation in cardiac patients, right, where they exercise after infarct or after transplantation and so on. So this is taking also from them. And as Enrico will say, the idea is very much giving the sense that patients taking the moment of surgery as a teachable moment to change lifestyle, to come in control of their health. That is important. So we are really educating them to control, and we want to make sure that the patient continue after surgery, because some of the cancer patients, as you mentioned, will go through chemotherapy, radiotherapy, so which are the stress. And therefore they have to feel comfortable that if they are prepared for surgery, they can continue to be prepared for other impairments which occur later on in life.
It's some sort of empowerment of their health.
They can control.
Exactly. So how many patients a year are you able to treat at the moment with the program at the Montreal General Hospital?
Well, there are not many, but there are many. So we are talking about, on average, about 200, probably. They're quite intense because the patient comes for assessment, first of all. It takes 3-4 hours for assessing. Then if they come to exercise 2-3 times a week, also takes a good hour. Then there are assessment, evaluation, how they progress, and takes another hour. So when you put in within 8 hours of work every day, we're open, it's a considerable part of the time. Most, I would say, are research, patient, but also, of course, some are patients who are referred by the surgeons for treatment, for taking care. So we assess them, and then we decide whether we can actually, they're fit for surgery or they need some rehabilitation.
Could you give maybe an example of just a recent case that you could tell all the benefit and improvement versus somebody who would not have done all this program?
Yeah, well, there definitely there are a few. One patient that I probably remember quite vividly was this lady was referred to us by general surgeons, and she came in a wheelchair. Basically, she was very tired, very depressed, and She couldn't walk very much. Otherwise, she was reasonably fit. A little bit of hypertensive, a little bit of arthritis, but not major. And so we did also assessment evaluation, and then we put her really under intensive program. And she came 2-3 times a week to be supervised. Because there's problem at home, we don't know exactly what they do. But if they come to us, then at least we know that they actually what they do. So we supervise, and within 4 weeks, she walked impressive.
Wow.
In fact, the patient was so pleased because definitely achieved. She could go for surgery. She went surgery. She stayed in hospital 2-3 days, no more than that. And she recuperated very well. And she came to see us after 4 weeks, 8 weeks. And she was absolutely back to normal, in full function, in control, and happy. That's what she called the happy clinic.
Yeah, that's good. Especially with the POP, happy. It all makes sense.
POP, happy energy. You're right.
So the patients who take part in the POP program know the date of their surgery and have time to prepare for it. But how much time do they usually have to prepare? You know, we're talking about weeks, months. I mean, this lady was a few weeks.
About 4 weeks.
4 weeks. 4 weeks, only 4 weeks. And
Yeah.
Do
you want to elaborate?
Yep. So everything is new because there's nothing in this field. So we just at the beginning we just had the idea to use the time we have before surgery, okay, to do as much as we can. Now after years we done a lot of research and we know that 4 weeks is enough to exert a good result.
Okay.
And that's really fits perfectly also with the operation time. We never posticipate the surgery. That's important because it's of course it's a key point in the care of the patient. And of course they want to have surgery, okay? And so we never posticipate, and the good point is that 4 weeks we have been shown that it's enough time to get a good result.
So it's maybe 4 weeks, like the lady, the example was like 3 times a week.
That's it.
Well,
It's remember that everything is personalized.
Yeah.
So how many times they come, which type of exercise, it's done with the bicycle or the recumbent bicycle or the treadmill. Everything is personalized. We have kinesiologists, so they are expert in sport that takes care about about the sport part. Then we have a nutritionist, expert in cancer patient, that takes care about just the nutrition. So everything is really personalized. Everything is really at a high level because we have no room to make any error because 4 weeks are enough, but we really need to start in a timely manner and works at high level if we want to this patient to get fitter before surgery.
Yeah, but this is amazing. I mean, it's like for a super athlete, you know, they get a team taking care of them and making sure that everything is fine. So they get you guys, a big specialist team helping them to be ready for this operation. So this is amazing, and it's like a gym kind of.
We do have
where
a gym.
you do it is like you're talking about a treadmill, a bicycle. So it's really like a small gym and where you actually train, physical training. Yeah.
One thing very interesting is that 4 weeks, first of all, because the oncological societies in Canada, in the States, and so on, established that this is the time from the diagnosis to surgery that is acceptable. So we try to work within the framework of 4 weeks, but also we found, as Enrico will say, that actually we have results with 4 weeks in terms of increasing the functional patient aspect of these patients. But what is interesting, because many of these patients are debilitated or elderly or frail, they actually gain more because they have a very little reserve with them, right? So if you push them, they actually are able to actually come up quite higher than you and me who already are reasonably fit.
Well, that is great. And you were saying, Dr. Minella, that the center here, the reason why you came here for your study is like one of the only one who's giving such a program in North America. I mean, this is quite something, and it surprises me that, you know, such programs are not developed elsewhere. Can you elaborate on that?
This is true. This is the only center in North America, and once again, the one that has been starting now in Europe. They try to replicate our model. Okay, so they came here, and we really have basically every month someone who comes from all over the world. I will say from Asia, from from South America, from US. It's really a new model. It's really a new model that has begun here, and I think McGill should be proud of that also because, and as you said, I come all my way from Italy just here in Montreal because it's a unique model. And I think we should all be proud. All the McGill community should be proud of that because it's really good. It's really good.
I think the McGill community is proud, Dr. Carli.
All of us. We all work together.
You can be happy.
We have a great collaborator. We have internists, we have surgeons, we have allied health, administrators, all very supportive, and that's very important.
Of course. So where do you see this going? Do you wish that, any medicine faculty, around the globe or this kind of program be more integrated to...
Yes. As Rico said, there is definitely an interest in, a wide interest. I would say what we need to do is make people aware of the need, right? And at the moment is very much based on volunteering and charities and so on, support and research. I think the long-term future is that definitely will become standard of practice.
Mm-hmm. Absolutely.
So that's why our rehabilitation is within the preoperative clinic, which makes sense because the patient are identified the one potentially at risk, and instead of being sending for surgery, they are going to the rehabilitation unit where they actually are prepared for surgery, and they're given the okay.
Yeah.
Okay, this is the model I foresee. And definitely there is a huge interest. The last World Congress, this is the second World Congress in Holland, where there were 200 people from all over the world. So definitely there is a community of surgical community, medical oncological community who are very interested. We are publishing in several journals, oncological as well, and I'm sure that it's going to happen, and it will take time, as usual. And of course, the question always is, who is going to pay for this? It's always the question raised, but definitely we can come around that issues if we are determined that is important for the hospital, for the patients, and for the society.
Well, it seems that the investment, it's a good investment. It's actually an investment to do this if you cut on recovery time and, all the health benefits that the patient will have on the long run, being more empowered by, for his health, taking care of his own health.
Yeah.
So,
yes.
Yeah, for sure. And where do you see, we talk a lot about med tech and artificial intelligence and all these new technologies. Do you see this coming in the field? I think probably some devices might be helpful to track patients' health. What are your thoughts about that?
We actually use some track devices, in particular watch, of course, active watch, in order to monitor the physical activity, because the other point is that we just don't want the patient come here at the hospital doing exercise. We want them to be aware about the type of exercise they could do before and after, and we want really to integrate some physical activity in their daily living. That's the reason why we provide the patient with an active watch, and we track their activities. Okay. Because it's not just 1 hour of exercise. We want to deliver a whole life change. So nutrition is one of the most, of course, one of the most important life change. And we want to promote physical activity that is different from exercise. So we want the patient to be more active, to start using stair instead of taking the elevator for free floors. We want something. We want some real change. okay, in their life activity. And that's the reason why, so it has already come. Okay, we just use the watch. I'm pretty sure we could go further. At the moment, we're at this level, but I'm pretty sure we could push further.
Or at some point find new partners and
That's it.
who could develop something more
Of course.
personalized and have, I'm sure, well, some are there, or we could get there to have this personalized device with, the program. You have to walk, a certain amount of steps, stairs, or
That's it.
or dance in your living room, perhaps. Salsa, if you can.
Of course.
Why not?
Of course.
Why not?
The question is that we want to know what they do at home.
Yeah.
So that's where we hope to have some sort of recording system where we can see the patients actually they exercise, and we can instead of coming here, which is expensive for them, the time is not right, the parking lot, people have to pay, they hate parking on the hospital. And so therefore that could be some way to, with the technology, to actually know what they do at home and train them while they train in the right way to do the exercise. So definitely the future is a lot of work on that.
Yeah, lots of new options and tools to help.
The virtual reality, absolutely.
Oh, yeah.
Yes, virtual reality is very will come.
And it's where the technology can actually help a real need, so.
Yes.
And you mentioned that people in good physical and mental health who have to undergo surgery some people don't necessarily go to the POP program. They won't be, pointed your way. But could you maybe give, a few ideas of what people who are listening to this podcast can introduce in their daily habits to stay healthy, live a better life, and be prepared in case they ever need to undergo a surgery?
The main concepts are always the same. So we need to promote physical activity in their daily life. So really they need to be active. For example, they could start, walking some flight of stairs every 2 hours, for example. And then they need to exercise. At least 75 minutes per week of a high intensity exercise, or 150 minutes per week of moderate exercise. And then for the nutritional aspect, there's just main element, the basic element, okay? And for example, for the nutrition, we know that we really want a good protein intake, okay? That should be 15-20% of their total meals. We want the fat not going more than the 10-15%, a good amount of carbohydrate, not simple sugar, not refined sugar. So there's this main element, this basic element that could be provided. But just to say, we do not give up with the patients that are fit. Okay, we just say that the one who are fit, they could come to our clinic, and we give them a kind of home-based, as we call. So they anyway, in any case, they have a consultation with us. Okay, we just focus our attention to the less fit patients, in the sense that we want them to come, we want them to supervise. Some patients are elderly, they not really do how to exercise, okay? A 40 years old woman, I'm pretty sure we could give some advice, okay? And she will be able to follow them, probably. So it's just, how we distribute our resource, okay? We don't give up with any patient. We don't leave any patient alone, of course.
Of course, yeah. What would be the next step, the next accomplishment you wish to make in order to facilitate patient lives? How would you see it evolve?
Well, first of all, I think it should be this program in terms of going through the MUHC or hospital. So we start already a little bit small unit at the Glen. But it's a very small, very specific for one type of surgery. But definitely we hope that this will actually increase in the few years to come. And then of course, there is some interest from the Francophone sectors in town, and also from other hospitals, peripheral hospital. As I said, it's going to grow. It's going to it takes time. Any innovation takes 20 times to be realized. So that's the future.
Oh, for sure. I think it's definitely the future, and hopefully, there are centers for rehabilitation. So why aren't there centers for,
Yeah, prehabilitation.
Prehabilitation,
Yeah,
exactly,
yeah.
exactly. No, for sure. Well, we hopefully you can duplicate this model, everywhere. I think every hospital should have such a program for sure.
Sure.
So,
But if you think about for a moment, is if you, I was talking to oncologist, and the moment you have a diagnosed cancer, you should really put in this concept of preparing for this stress. It doesn't matter whether it's going to be a chemo, radio, or surgery. These are all stressful events. One is physical, because of the surgery, and the other one is toxic too. But they're no difference. They cause the same upset, physiological. Patients are tired, they're nutritionally depleted, physically sedentary becomes. So it makes sense that you enter in this concept of rehabilitation. So I think that will come more and more, in my view, of preparing this as soon as you get into the concept, into the system. And then you triage, and you see the patient are a little bit more fit, that maybe they need a psychological aspect. They don't need the nutrition because it's doing really well, and they are very fit and so on, but they might need a psychological aspect. They said, the patient actually needs some help from reorganizing the nutrition point of view, but doesn't really matter. And then you enter into this program, which really covers the patient and follows the patients, because you're preparing for the next impairment, which could be whatever is, even another type of surgery or another infarct or arthritis. So, but they are already preparing in the mind what to do when this stressful event comes. So it's really a global.
Yeah, of course. And absolutely, as you're saying, even, mindful. And even for somebody who's fit, I mean, even after surgery, the way you can recover from it, you need good advice also. What to eat? Is there something I can eat that's going to help me recover better? Or, even the cardio. I mean, somebody who's fit might not necessarily have a good cardio. It could have cardiac problems anyway. So no, for sure, all this needs to be addressed. In your case, as a student, and probably I don't know if you're planning on going back to Italy after your studies, but what do you hope for? You're the new recruit who's going to bring this new program wherever you're going to be working?
We need to spread the voice, but I think the concept is that from a scientific point of view, we have enough data now, and now it's being recognized. We have publication, and then we have conference. As we said, we're at the second World Conference just on this topic, just on rehabilitation. It really involves, physician, nutritionist, kinesiologist, physiotherapist from North America, from Europe. So I think that's with strong base. We really have a strong rationale now. The next point will be, of course, spread this program. Is not just common sense. We went from common sense, exercise, nutrition to get fitter, to a clinical reality, and now we need to go all around talking about this clinical reality for patient, because the patient is always in the center. Okay, it's always the center of our work, and the concept that the patient is there, becoming more aware about their care. Okay, before was like normal, because the patient would say, okay, I'm gonna have surgery, so it's normal that I feel weak. It's normal that they will take now it's taking 3 to 6 months to going back to their normal life. We're talking about even not major operation. Okay, I think the patient now is becoming aware about their health right, okay, and they have the right to go through cancer care, to having a cancer, and keep having their quality of life in a good level, okay. So I think that should be the clue point of spreading the voice. The patient talks a lot, and that's they're really enthusiastic when they come to us. And the great feedback we have and the great success we're having is just because the patient talk. Okay, we're going around conference, we're writing paper, but that's always that's the most effectful consequence of our work now.
For sure, and you were talking about common sense, and it's true. Sometimes common sense is unfortunately not enough.
That's it.
And data is very important, especially nowadays. When you can bring numbers to the table and show this is how much if you cut on rehabilitation aspect of it after the surgery and everything. Of course, this data will talk for sure.
And now these data are available because in our group we show that the vast majority of the patients following our program, they recover to their physical level in 1 month after surgery. So
and that's why like you were saying, 4 weeks of
it's 4 weeks. It's 4 weeks
of exercise before
of exercise and nutrition, no drugs added,
no drugs and no drugs. How's that?
Even though we're an anesthesiologist with no drugs, okay?
Exactly. Well, that's really important to say also
course.
because, and even some patients don't support medication or some, drugs. So, yeah. Well, thank you so much for your time today. This was super interesting, and hopefully you can spread this program in many hospitals as possible. So, thank you so much.
Thank you for having us.
Thank you.
So thank you all for listening to the Code Life podcast. For more information, I invite you to visit our website, codelife.ca.